As the years pass, you might notice all kinds of changes. It's common to chalk some things up to natural aging, I guess.
But what if it isn't? Even more, what if you could do something about it? It's that quest that brings men to the Omaha TRT Institute.
Here this morning, Gabe Sullivan. Good morning, Gabe.
Welcome.
Morning,
it's nice to meet you.
I've gotten over the age of 40, so I started paying attention a little bit more to these concepts. But describe your clinic.
At the Omaha TRT clinic, we're dedicated mainly to men's health, but we specialize in hormone replacement, so that's low testosterone. Men come in, they have a feeling of fatigue, low libido. They've lost that drive that they had in the past, and we try to help them, and we try to find it and figure out what the problem is and get it back.
Do they feel like that it's just part of aging? They've put up with it for a long time?
They do, and that's when we do our initial consult, that's almost always what I hear is, I know I'm getting older, but, and that's something that should never be repeated. That should never be said. It doesn't have to be that way.
Fatigue, though, that's one of the biggest symptoms. But are there other symptoms out there that men should be paying attention to?
There are a lot of them actually, and unfortunately, a lot of gentlemen go to the regular physician and end up getting diagnosed with depression because it just puts them in this state where they have no drive. They go home, they go to work, they go home, they sit on the couch, they look out the window, they watch the grass grow. Their spouses become irritated. They become moody, loss of sleep, loss of appetite.
Wow. What you were saying to me, all of that stuff would affect every aspect of your life.
Every aspect.
Like the relationships, your self-confidence. It's not just about, like, am I myself any longer? It's every part of life. So what can you do about it?
Continually down, just spirals down. Pretty simple, actually. I mean, it can be fixed pretty simply.
There's a test, right?
There is.
Test for it.
So you come into the clinic, we go through some initial questions, we make sure that you qualify, and we do a simple blood test. And within 2 days, we can have this back. And what's really neat about the therapy is that after you start, you immediately start to feel better. They start to get that drive back, that libido comes back up, that fatigue starts to go away. It can be a longer process, but in the beginning, what's neat about the low testosterone treatment is that once you start to feel better.
Yeah, and it's interesting how much more we hear about it now. I mean, low T. You hear that? I mean, the term is for low testosterone, but what do you actually do to treat it? How do you treat low testosterone?
There's several ways to treat it. The best way is through an injection, and you can do that in clinic or you can do it in the office. What people don't understand about low testosterone is once you start, it's kind of like insulin to a diabetic. So if you stay on the medicine, you're going to be better and continue to feel better. But the injections are painless. We run periodic lab draws every 5 weeks to make sure that we're watching that medicine and watching how your body handles it.
So when you're drawing blood, is part of that to then tailor the treatment to that patient because it's not going to be the same from person to person?
Everybody is different. So medicine, we don't know how it's going to react with everyone. So we want to watch that very closely. So we're more preventative than reactive.
And similarly, this is different for different people. I assume the time between treatments is different for people too.
Actually, no, the time isn't. It's testosterone works on a 7-day cycle, so an injection has to be given every 7 days. By day 8 or 9 after your day 1 injection, that medicine is gone. Your body has absorbed what it needs, and it's starving for more. That's why you're getting the injection, because your body's not producing naturally what it needs to function.
Gotcha.
Okay, so the clinic, you were telling us a bit about it, but a few points about the staff.
Our physician, Dr. Jeffrey Passer, just received a 40-year plaque from the Med Center. He's been doing anti-aging in Omaha for a very long time.
And why is it important to have a physician who's overseeing what the patients experience?
With the physician, that's one thing you want to make sure is you have a physician in-house at all times. It's a controlled substance. It's a medication, so we want to make sure that your body's accepting it right. And with someone continuously looking at the labs, following up, checking on you on a weekly basis. We check on our patients on a weekly basis. It's very important that the person that's doing that understands how the medicine works, and Dr. Passer is one of the best in the area.
Like you said, these weekly checkups, these weekly treatments. So let's talk about cost here. And is this something that insurance covers?
It is. It's very insurance friendly. You know, what we do, and that's why we initially do the first blood draw, is to make sure that this is the medicine you need. Just because you come in and you say, I have the symptoms of low testosterone, doesn't mean that it is low testosterone. We're going to help you find out what it is, but at the same time, if you don't need that, then we're not going to give you medicine just to make you feel better.
You mentioned some of the areas, low libido, fatigue, sleep apnea. Is that something else you can help men with?
It is. We just started doing what's called an in-home sleep study. A lot of men suffer from sleep apnea. And one of the disadvantages to finding out if you have it is having to go into the hospital.
Right, and how do you sleep there
anyway?
I've never understood that.
And the cost is phenomenal. What we have is we actually have a new machine that's hit the market. You actually just take it home, put it around your waist like a belt, lay down, go to sleep, bring it back to me the next morning. We'll transfer the results to a board-certified sleep doctor, and we can have your results within 5 days.
Wow.
Yeah, all these symptoms are something that many men face, and you've got a special offer that you brought. Through the month of September, first responders, active military, and veterans will receive a free consultation and a free blood
That's
draw.
wonderful.
Absolutely.
So
Absolutely.
let's give you a couple of phone numbers here. You can call toll free or call locally because this is a local institute, 552-2900. Online, it's jeffreypassermd.com to learn more about the Omaha TRT Institute. Gabe, thank you for joining us
Thanks
today.
for
We
having us.
appreciate it.
Thanks a lot.
Appreciate it. Thank you.
The Untamed Shrews.